A diabetic patient presents with fruity breath, abdominal pain, and deep rapid breathing. Which diagnosis is most likely? A. Hyperosmolar hyperglycemic state. B. Diabetic ketoacidosis. C. Hypoglycemia. D. Metabolic alkalosis. Answer is B. Diabetic ketoacidosis. Because of fruity breath and small respirations are classic findings in DKA caused by ketone productions. A patient presents with resting tremor, rigidity, and bradykinesia. What is the diagnosis? A. Huntington disease. B. Alzheimer's disease. C. Parkinson disease. D. Multiple sclerosis. Answer is C. Parkinson disease. Because Parkinson disease results from degeneration of dopaminergic neurons in the substantia nigra. A patient complains of chest pain that improves when leaning forward and worsens when lying flat. Which condition is most likely? A. Myocardial infarction. B. Pericarditis. C. GERD. GERD. D. Pulmonary embolism. Answer is B. Because of positional chest pain relieved by sitting forward is a hallmark of acute pericarditis. A 30-year-old woman develops butterfly-shaped facial rash that worsen with sun exposure. Laboratory tests reveal anti-dsDNA antibodies. What is the diagnosis? A. Rheumatoid arthritis. B. Sjogren's syndrome. C. Systematic lupus erythematosus. D. Dermatomyositis. Answer is C. Systemic lupus erythematosus. Explanation: the malar rash and anti-dsDNA antibodies are highly suggestive of SLE. A 65-year-old smoker develops painless hematuria. Which diagnosis should be suspected first? A. Renal stone. B. Acute cystitis. C. Bladder carcinoma. D. Pyelonephritis. Answer is C. Bladder carcinoma. Because of painless hematuria in an older smoker is bladder cancer until proven otherwise. Smoking is the strongest risk factor. A child presents with fever, drooling, difficulty of swallowing, and sits leaning forward. Which diagnosis is most likely? A. Croup. B. Epiglottitis. C. Asthma. D. Bronchiolitis. Answer is B. Epiglottitis. Because of drooling, dysphagia, and tripod positioning are classic findings of epiglottitis, a medical emergency. A chronic alcoholic presents with confusion, ataxia, and ophthalmoplegia. Which vitamin deficiency is responsible? A. Vitamin B12. B. Vitamin B1 thiamine. C. Vitamin C. D. Vitamin D. The answer is B. Vitamin B1. This triad describes Wernicke encephalopathy caused by thiamine deficiency. A newborn has a continuous machine-like heart murmur. Which congenital defect is most likely? A. Ventricular septal defect. B. Atrial septal defect. C. Patent ductus arteriosus. D. Tetralogy of Fallot. Answer is C. Patent ductus arteriosus. PDA classically produces continuous machine-like murmurs. A patient presents with severe epigastric pain radiating to the back. Serum lipase is markedly elevated. What is the diagnosis? A. Gastritis. B. Cholecystitis. C. Pancreatitis. D. Hepatitis. The answer is C. Pancreatitis. Elevated lipase and back radiating abdominal pain are classic signs of acute pancreatitis. A 28-year-old woman develops double vision, ptosis, and muscle weakness that worsens throughout the day. What is the most likely diagnosis? A. Multiple sclerosis. B. Myasthenia gravis. C. Guillain-Barré syndrome. D. Lambert-Eaton syndrome. Answer is B. Myasthenia gravis. Myasthenia gravis is caused by antibodies against acetylcholine receptors and classically worsens with activity. A patient presents with calf swelling and pain after a long international flight. What is the most feared complication? A. Stroke. B. Myocardial infarction. C. Pulmonary embolism. D. Heart failure. Answer is C. Pulmonary embolism. Deep vein thrombosis can dislodge and travel to the lungs, causing a life-threatening pulmonary embolism. A young patient has recurrent kidney stones, bone pain, and elevated serum calcium. Which endocrine disorder is most likely? A. Hyperthyroidism. B. Hyperparathyroidism. C. Hypothyroidism. D. Diabetes insipidus. Answer is B. Hyperparathyroidism. Stones, bones, groans, and psychiatric overtones is the classic presentations of hyperparathyroidism. A child presents with recurrent lung infections, pancreatic insufficiency, and elevated sweet chloride levels. What is the diagnosis? A. Asthma. B. Tuberculosis. C. Cystic fibrosis. D. Bronchiectasis. The answer is C. Cystic fibrosis. CF is caused by a CFTR gene mutation and is diagnosed with a positive sweet chloride test.